If you're someone with a severe mental illness, you're more likely to be a victim of a crime than a perpetrator. Even so, many jails are filled with those who should be receiving care, not prison sentences. That's where the Oregon State hospital system comes in. But that care is also at risk. Governor Kate Brown may close one of the 2 psychiatric hospitals in the state next year in an effort to balance the budget. I spoke to one woman who says that hospital saved her daughter's life.
It probably started when she was in high school and there was a change in her.
As a mother, all Cheryl Spangler wanted for her daughter was a normal life.
You hope that the only thing that you go through with your kid is the worst, maybe a broken leg or a divorce or troubles getting a job.
But Abra was different. An illness was growing inside her that couldn't be cured, only controlled.
The first time we went in, she was probably bipolar. And then the next time it was SAD, schizoaffective disease. And then they went to, we're pretty sure it's schizophrenia.
Imagine you're in a room with hundreds of televisions, all on different channels with the volume turned all the way up. Now try to focus on one television. Focus on one sentence. Now imagine that noise every second of every hour of every day. That's the reality for 2.4 million Americans with schizophrenia.
So she goes through that kind of thing, and it's constant. She's burned herself with cigarettes because the voices said they were doing that to her son. So she would do it to herself, hoping that they would be nicer to her son. So she has some pretty deep scars.
At 30 years old and pregnant with her first child, Abra's family sought help.
And they tried medicine after medicine, and there was one where she would get up and walk out of her room and fall down. She'd kind of just black out.
Years of trial and error brought her to the Oregon State Hospital in Junction City, a facility that caters to the needs of the state's most ill, while also preparing them for life after treatment.
People are learning to be line cooks. People are learning dishwashing, barista skills. We have woodworking.
The unique layout of the hospital mimics the real world, with libraries, a bank, even a salon.
One of the things we are always trying to do is help clients learn internal skills, how to not rely on external ways of helping them calm, but instead learn internal ways.
That structure, Spangler says, may have saved her daughter's life.
If she hadn't have had this medication and these people diagnosing her in the jail and in the hospital, I'm terrified of thinking that would happen to her.
But the hospital could close next year in a budget proposal by Oregon Governor Kate Brown. That's creating uncertainty for the hospital's 81 patients, nearly 24 of whom are from Southern Oregon. If no room is found at Salem's hospital, those patients would return to their communities, many of which simply don't have the ample resources needed to care for them.
Most counties around the state don't have that local ability. They just don't have placements for people and to give them the regular counseling and the regular medications to get them to where they can aid and assist.
When you think of the statistics, which be 1 in 4 to 1 in 6 people, at some point in their life will have a problem with their mental health that impacts their ability to function. And there aren't nearly enough hospital beds for that.
And while Abra has moved to a different home, Spangler says it's a dangerous idea.
I'm surprised at how little we do for them. Like wanting to close down the hospital. They never really have given it a chance, and they're basically taking the weakest population and just putting them out there.
She says more help is needed, not less.
We need to be proud of what we do for our mentally ill, not be ashamed and just put it under the carpet.
Abra now lives at an adult foster care home in Cottage Grove, while her mother cares for her 2 boys. Governor Kate Brown has said that she's willing to keep the state hospital in Junction City open if additional funds are found. In studio, Matt Jordan, NBC5 News.